Hello everyone, this is Shadi Reyes from SIF 22. With me is Dr. James Goldstein. He is the Director of Research and Education at Beaumont Real Oak. Dr. Goldstein, always pleasure to see you at SIF. I learned a lot about you from hemodynamics to RV to PFO, but now recently you are bringing us some new awareness which is important to interventional cardiology, which is radiation protection. Why we should worry about it, and is it too late?
The data is now clear. Working in a fluoroscopic laboratory, the cardiac catheterization laboratory, is intrinsically filled with occupational hazards.
Yes.
It's been well established through various research studies, publications, and statements by societies, including the Society of Cardiac Angiography and Intervention, documenting an epidemic of orthopedic issues related to wearing the orthopedically burdensome leaded aprons that are necessary to protect us.
Yes.
And that despite wearing the aprons and the collars and the glasses, we're still exposed to radiation to our brains, to our eyes, to our arms and our legs.
Correct.
And the radiation-induced injuries, including cataracts, are well documented, concerns over cancers, skin cancers, breast cancers, left-sided brain cancers are now being published. There's not causation yet, but concern. And thinking about it from a practical standpoint, who would go into a career where you're walking into your workplace, spending 8 or 10 hours a day, getting radiated, being incompletely protected, and wearing orthopedically burdensome lead aprons, which you know has a high likelihood over 10, 20, 30 years of inducing significant injuries to the spine, hips, knees, and ankles. So there's been an increasing awareness of this issue, increasing amount of data that documents it, and now for the first time in the past 4 or 5 years, there are a number of commercial products that have come to fore that allow operators, and for some of the devices, perhaps also to protect the allied staff, because it isn't just the physician operators. It's the entire cath lab staff
nursing staff
that's exposed to radiation, that's wearing lead, that has the same risk of these radiation-induced injuries and these orthopedic injuries, and there are now systems available that can mitigate these risks.
So we think we're protected, as you said. Go to the lab 8, 10 hours, we think we're protected. Legs, arms, head, all exposed. Even with no-brainer, I think still our face and lead glasses. But the physical burden, I start to notice that myself in terms of how much physically it's demanding, and the lead, regardless how light it is. So what is in the pipeline right now? And we saw some live cases from Dr. Ryzik lab at SIF. What is completely radiation is completely blocked for staff, operator as well as staff.
You're referring to the Protego radiation protection system, which is made by Image Diagnostics Incorporated out of Fitchburg, Massachusetts. And I'll disclose that I have been involved as a developer of this technology, and I have an equity and a conflict of interest. But the system was designed to provide a complete radiation protection barrier that totally protects the operators, and to the extent that any of the circulating nurses or technical staff are on the protective side of the radiation shield, that they're also protected. And it consists of an upper shield that's suspended from a pedestal that floats, it connects to the table, and it's cantilevered so that once the shield is set onto the table can be panned without any inhibition, so free table panning, and it's cantilevered such that there's full complete motion of the C-arm, so that there's no compromise of all the angles that any interventionists would want to achieve for diagnostic and structural cases. There's a lower table shield that attaches to the table itself, and there are interconnecting soft drapes that bring together the 3-part component to complete the protective shield. We've done radiation testing first in vivo with an independent radiation physicist at Beaumont Hospital by Dr. Maher Rabah, and radiation physicists. The state of Michigan has come in with their own independent radiation physicists, and now published a year ago that this shielding system blocks radiation to the 99% level. Wow. It's better than personal protective aprons, and they have approved formally that if you're using the shield, you do not need to wear lead aprons. And these cases have now been done at Beaumont for the past several months with extremely low radiation exposure. In many cases, zero, as were the live cases here at the Scottsdale Interventional Forum. The first 100 cases are being reported at the Society of Cardiac Angiography and Intervention, such that the average exposure, as seen in the cases that are being reported at Beaumont, are such that an interventional cardiologist like yourself could do 1,000 cases a year and be at 15% of the maximum allowable by the ALAR's lowest reasonable achievable standard, which is 5,000 millirems. 1,000 cases using the Protego shield, you would be exposed to 15% of that. So we feel this is a major step forward to be able to allow the operators and the staff to do their work, to take care of patients, to enjoy their careers without radiation and without the orthopedically burdensome leaded aprons.
Yeah. So how easy is it to set up that system?
Very easy. The table side shields are connected and stay in place. Patient's placed on the table, prepped and draped. The upper shield is suspended from a pedestal. It's swung over. There's a taco shell type sterile drape. It's dropped down. It connects with magnets to the table with quick release should you ever need to remove it. Then the patient drapes are soft drapes that have also sterile drape upon them. They're placed upon the patient. So it's 1, 2, 3, set it and forget it.
Nice. So this is I think in many years this is the first innovation that's going to be blocking 100%, that proven by physics, as well as physically not demanding from interventional cardiologists. So what are we waiting for?
I think the time has come, and I gave a presentation at CRT, and somebody asked me the question, how do we convince our administrators to purchase these systems? And all the systems where it's zero gravity, that people are familiar with.
Individualized cabinets.
There's some other systems out there that have their attributes, and I'm just going to comment on what I see the strengths of the one that I've been involved with. But there are commercially available systems out there that provide enhanced protection. And when I was asked the question, how do we get our administrators to pay for
Believe
this?
in that, yeah.
Because they're not going to be able to get reimbursed for it. And I thought, I paused and I said, I think that's a 10-year-old question.
10 years.
10 years ago, we worked in a cath lab where we put our little shields in front of us, we ate the radiation, we didn't try to worry about it because there was nothing we could do about it. We wore orthopedically burdensome lead. But now there are commercially available systems out there that provide enhanced protection. So the message to administrators should be that it is no longer acceptable to ask us, physicians and nurses and techs, to work in an environment that's inherently injurious when there are protective systems out there that are commercially available. We're going to evaluate and choose which one we think is best for us, and you're going to write the check. Not, would you please put it in your capital budget next year or the year after, but this is obligatory.
Occupational health issue.
It's obligatory.
It is. So it's a matter of campaigning. How about societies? Are there societies pushing, advocating for this?
The societies have been advocating for enhanced awareness and data and protection for the past 20 years, and I've been involved with the multi-specialty occupational health group that was first formed by the Society of Cardiac Angiography, and then ACC became involved in electrophysiology and some of the interventional radiology societies. We've published numerous papers. So the societies have been major advocates, and they've been moving along. So I think societies deserve a lot of credit, and I suspect they'll do more.
Okay. Well, we're looking forward to have this at least available in our lab, because as you said, it's time for, we don't want to wait 10 years in occupation or in the job and then start to have physical burden or pain or orthopedic issue and then start to ask for it. Time is now.
Yeah, it's like having a car, not just with no seat belts, but with airbags.
Exactly. Dr. Goldstein, thank you so much for your insight about radiation and the new technology that you developed. And thank you for all of you watching. This is Dr. Reyes from SIF 22. Watch this video and others on SIF YouTube channel. Dr. Goldstein, thanks so much.
Thank you.